Now, concerns about the presence of the Omicron variant in country have spread as the COVID-19 positivity rate climbs in the country. Health CS Mutahi Kagwe has dismissed these claims, saying that no one has tested positive for the Omicron strain so far. This comes as the World Health Organization announced that Africa is officially in its fourth wave and warns of more to come in 2022. Ngina Kirori has that report.
The country's vaccine drive continues to take center stage, with officials from the Ministry of Health saying that it might be the silver bullet in the fight against COVID-19. And as the Omicron variant spreads around the world, there has been some speculation over whether it has made its way into Kenya. However, Health CS Mutahi Kagwe refuted claims that the variant is widespread in the country.
What we have so far in the people who have been hospitalized is that essentially it's all Delta, the Delta variant. We do not have anybody hospitalized with the Omicron variant, so we are hoping that that either A is a strain that is very mild, or B is something that we are going to overcome easily.
In the last 2 weeks, the positivity rate has increased from 1% to 11.5%. Despite this, the Ministry of Health believes it is too early to implement strict measures to control the virus's spread.
We can be able to avert more stringent measures by us simply going for vaccination and also adhering to the public health social measures of avoiding crowded places, avoiding closed spaces and avoiding close contact.
Watu wengi wakienda kuchanjwa na tuwe tumechanjwa, hakuna haja ya lockdown.
Out of the roughly 3.2 million people who have been fully vaccinated, 8,000 teenagers have been inoculated against COVID-19. The Omicron variant, which is said to be spreading faster but with less severe effects, has been linked to 2,700 cases in 57 countries. According to the World Health Organization, just 6 countries have achieved 40% vaccination, with inoculation for African nationals hindered by Omicron travel bans. Kenya still has millions of people to vaccinate, and while WHO warns of new waves and variants in 2022, governments will rely on the good behavior of their citizens to reduce the surges, as well as government surveillance. Meanwhile, immunization coverage has stagnated at 80%, with some vaccines, such as HPV and measles rubella, trailing at 30% and 50% respectively. This is mainly blamed on the pandemic. Ngina Kirori, NTV.